Okay, so we're at the beginning of a data revolution in health, right? Our genomes, our medical records, mobile, wearable, social, all these data are becoming available. And with that, we'll be able to undertake new analyses, gain new insights, even take new actions in a way that will be truly transformative. But this is not a linear path. And I want to talk to you about a particularly important data set which is essentially locked away. So medical research is one of the key drivers of innovation in healthcare, but the conduit from research into practice is through academic publishing in medical journals. And what really drives research is actually volunteers. It's volunteer effort of patients putting themselves forward, taking risks for the betterment of others. But the first problem here is that all that knowledge that's generated through volunteer effort, half of it is never seen. So half of the clinical trials that are conducted are never published, never released. And it's not a random half. It's more likely that positive results are published. So how can we ever know what's happening in healthcare? There's now this global campaign called All Trials, hundreds of organisations now working together to make sure that every clinical trial that is conducted is published and made available. So here's the second problem. Once published, it's often published in journals where the paywall is so high, only institutions can afford access. So the open access movement is now changing that, making it free and open so all of us can read and understand those trials. So then what happens is then we rely on doctors and other healthcare professionals to read that literature, to keep up with the research. Well, there's now so much research occurring that it's impossible for anyone to actually keep up with that. Now, I'm a doctor, I see this every day. We read the literature as we can, we do the best, we talk to our colleagues, but essentially we're only ever accessing a subset of the research that is published. And then we participate in and we rely on panels, guideline panels, to guide our practice. But what if those guideline panel members are also only aware of a fraction of the research? Then they're open to influence and bias and opinion. So this is a tragedy. Our investment in research, the participation of volunteers in the clinical trials is being wasted. So there's a missed opportunity here to drive innovation. So there is another approach which is called systematic review. It's a particular methodology of taking all the data that's available for any healthcare question and distilling it down into like a final bottom line. And this process is now like an essential ingredient in healthcare systems. So organisations like the Institute of Medicine now mandate this as a particular practice from taking research into guidelines and into healthcare practice. But the problem is that currently it's so manual and so time-consuming, finding the data, extracting it, analysing it. It's systematic review is a scarce resource. And it's incredibly difficult to keep systematic reviews up to date as new research becomes available. But there's now innovation occurring in this space. So there's business process improvement. There are platforms being developed specifically for these tasks to improve efficiency through better collaboration and workflow management. There are machine learning, natural language processing, machine techniques that enable much more efficient identification of the research that's relevant to any question, extraction of the data from the full text articles, and combination in analyses. There's also new models of collaboration, of participation, of using crowdsourcing to help identify studies, and in ways that have been proven to be as effective as expert involvement. All of these systems are now working together with new data systems. This makes this process actually much more challenging. There's more data now available, but it also opens up opportunities for new methods of linking, merging, automating the process, again, driving efficiency. So where is all this headed? So you think of the Human Genome Project, that unleashed a heap of data and launched a revolution in omics that we're now seeing today. So that's our mission. We want to unleash the data that are in clinical trials, value the participation of all the volunteers who generated those data, and let the research speak to drive innovation in healthcare. Thank you.